are going to talk tonight about alternative mainstream and why you should pay attention to lifestyle medicine. This is such a broad topic, but I'm excited to cover it with you. My name is Sarah Tegender. I'm the National Sales Manager for nutraMetrix, and I am so passionate about lifestyle medicine. I'm passionate about alternative and complementary medicine, and I'm passionate about this personally as a mom of one and one on the way, hoping that healthcare continues to just grow and accelerate for my growing family, but also professionally, because I'm seeing some huge trends right now that I want to share with you about what is going on in medicine. I have worked in the field myself for the past 12 years, and I want to tell you a little bit about what I've been seeing firsthand and its clinical applications and how it's going to make a difference for patients, how it's going to make a difference for providers, and just change the scope of healthcare in general. Tonight's call is hosted by nutraMetrix. nutraMetrix is a division of a larger company. It's been around since 2004, and we're passionate about changing healthcare through our products and services that are scientifically backed, that are delivered by really great technology as well, and we're committed to doing this to help one patient and one practitioner at a time. Tonight I am joined by Danielle Gaminsky. Danielle was a nurse for 12 years before retiring. She's from Paducah, Kentucky, and she is a mom. She is really passionate about health as well for her and her family, so tonight should be a really dynamic discussion. And Danielle, thank you so much for joining us.
Well, thank you, Sarah, for having me.
So we just want to, we're going to go back and forth. Danielle and I, we've been talking now for about a year with one another, and I'm just so excited to share Danielle's experience both personally and professionally on the call. But I want to just start by giving our audience tonight a little bit more of a background about what I mean about lifestyle medicine. And what we're talking about is a scientific approach to decreasing disease risk and illness burden by utilizing lifestyle interventions. So the things that we're talking about are, nutrition, physical activity, stress reduction, some prudent recommendations like rest, smoking cessation, and avoidance of alcohol abuse. But lifestyle medicine is now growing for practitioners as the recommended foundational approach to preventing and treating many chronic diseases. And I think that this is timely. We're talking today in the month of March. That March is National Nutrition Month. February, we just came off of Heart Health Month, if you joined us for last month's topic. And we just continue to talk about chronic diseases, which are now responsible for 70 to 80% of all healthcare expenditure. Yet most health professionals treat chronic disease the same way that they would treat a communicable disease. So they're just solving some sort of problem with pills or injections. And this might temporarily reduce, some acute symptoms, but it's not addressing the underlying cause of the chronic disease. And that's what we want to talk about with nutraMetrix. We want to talk about the patient as a whole. We want to talk about what is really going on with them and how can we reverse this. Most physicians and health professionals receive little to no education on nutrition, exercise, rest, social connectivity. These are the 4 pillars of lifestyle medicine. And Danielle, I just want, can we go back to when you were studying to be a nurse, to get your RN, to pass those boards, and then to speak a little bit towards your clinical experience that you have with some of the other RNs, MDs, NPs, other practitioners that you worked with, and what was the education that, what did you receive any alternative and complementary training for the degree, and where do you think some of the pitfalls lie?
Man, Sarah, you're asking me to remember back to a long time ago.
No, it wasn't that long. So
it feels like forever ago, but no, that when I started in all of this here with nutraMetrix about 3.5 years ago, I was thinking back to when I was in nursing school, and I took one nutrition class.
Wow.
I learned about the food pyramid, but nothing about like alternative medicines, about how especially with diabetes, getting people eating healthier. Type 2 diabetics. That can be reversed and these people can get off of their medications. I do not recall learning any of that. And that was actually my first nutraMetrix training was in, spring 2013. And I remember coming home from that just blown away and telling everybody, I'm like, oh my gosh, I just learned way more about health and nutrition and supplementation than I ever did in the 5.5 years I spent in college. I was just blown away by how much we can change, and fix those chronic diseases through nutrition and proper supplementation versus stopping for everything.
Some of our more, complementary professionals, like maybe an acupuncturist or a doctor of chiropractic, they tend to have some more hours of training. But did you feel as if the same rang true for the MDs that you worked with, that they had nutrition training?
I can't speak on how much actual training they had. I know they didn't seem to have the time to be able to delve into those issues with patients. It was a lot easier to put them on, this pill that the pharma reps are saying is really good and going to work on that issue.
Treating those acute symptoms, exactly what we just talked about. Yeah.
I know my mom is a physician's assistant. She was a registered nurse for years before that, but in all of her years as practicing as a PA, she did not go into anything with alternative medicine, alternative lifestyle. Because when I started talking to her about, her health issues and let's try some alternative things, she kind of like poo-pooed me off. She goes, oh, you're just, you're a nurse. I've gone to all these trainings. She was used to treating things with a pill.
Yeah. It's
pretty sad. I'm still working on her.
Many practitioners have like the same story. They're struggling with the time that it's going to take for them to learn about it, the time that they, have to meet their patients' needs. And there's a lot of pressure today on documentation, electronic health records, keeping up with CMEs. If you're in private practice, just all of the burdens of running a practice. And it sometimes can take the focus, unfortunately, away from the patient. But we're in this battle right now. We're in this battle with chronic diseases like diabetes, heart disease, obesity. This continues to escalate. And so I want to know, from your experience, knowing your mom and knowing physicians that you've worked with, is integrating some lifestyle counseling, is it a huge time burden? Are there limitations? And I'm sure that there's learning curves. Now, could you speak to a little bit, because you've worked as an RN in a few different settings, and then you even took your RN degree and flipped the tables, and you were working as a consultant for a while. Could you just let everyone know the different environments that you have worked in? And if you could just speak to some of the stressors that healthcare providers are under today from your experience.
From my experience, so I spent, my first year of nursing working cardiopulmonary floor, and, those physicians were coming in at 4:30, 5 o'clock in the morning to do their rounds, and because they had to get into, get to the office to see patients all day. After that, I went to the ER, and I worked ER for about 5 or 6 years. And, they were completely, they were understaffed. Doctors are having to see patient after patient after patient. And they're basically, treat them and street them, or treat them and get them, upstairs or to surgery. I worked as a sales rep. I sold oxygen for a year because, I thought, okay, I can help patients this way, but I wasn't comfortable, with being a pharma rep because I was afraid I would get stuck with a drug that I did not believe in, and I would not be able to go and passionately talk about it to physicians. So, oxygen, I think we all agree that we all need some oxygen. So I felt comfortable with that drug. At least that's, that's how some doctors, when I would go and see them. And they go, hey, why aren't you working as a nurse? Why are you doing this? And then I went on to working in surgery as well as home health. I loved home health because you got to work with keeping the patients in the home. So as a nurse, you had a little bit more autonomy that I could talk to them about nutrition. It may not have been in the doctor's order, but, I could talk to them just as a friend, as I'm checking the vital signs and different things. But there's so, in my area, we have maybe 5% of our physicians have been able to financially not have to sell out to the hospitals and become hospital employees. Because there have been so many cuts with insurance, Medicare, Medicaid, whatever it is, that they're struggling to bring in the money, money to keep their business afloat and pay their staff. So they're having to see patient after patient, 5 minutes a patient, and the patient's not really getting the time that they need for the doctor to delve into the actual issue and what they need to work on versus let me just write you this script. Electronic records there, it just seems like the doctor's face is in the computer because there is so much of an emphasis on documentation. In healthcare as well as anything, you have to document. You have to document your butt off to cover your butt because people are so litigious. And so, they're making sure that they are documenting every single word they say and not being able to give that patient the more hands-on time. I think it's sad. It's sad that because of funding that doctors aren't able to treat the patients the way they probably truly want to.
And then get paid for their time. I mean, that's part of the documentation as well. It's just proving what they're doing. Treat the patient exactly, and that it's worth it. And one of the things that I try to do as the sales manager, and I train on a national level, as you know, is to work with teams of people. And so I love working with people with such a passion for health and wellness like you, Danielle, because it takes a whole village. It takes the person that's taking the vital signs to start the conversation, and then maybe move it over to the physician who moves it over to, maybe it's a triage nurse or phone call or staff member. And sometimes people need to hear these things multiple times because
absolutely,
frankly, what we've learned, like you said, I mean, the food pyramid, we don't even have a food pyramid anymore, right? Isn't it? It's a plate. It's a my plate now.
Yeah.
Because they know it didn't work. What was taught for years, what we always knew, is just making our country sicker and sicker. And so what I like is exactly what you're describing, is what you started to create was that teamwork environment that I'm sure, that you're able to work now within healthcare in a much better team environment that you weren't able to work in within a hospital setting or within necessarily a home health setting. Is that right?
That's correct. And that's one of the things I love about nutraMetrix is that, the physician is also getting the support of a team of nutraMetrix consultants who, we're not on their time clock. We're able to work with their staff and help to, to get that process going in their office. Like you said there, it starts with the front desk person and goes to the triage nurse, and whoever down the line. And it makes it more streamlined for the physician office to get the patient the better care that they need.
They're not alone in it. So that does take a lot of the burden too off of the time where they say, this is going to be a learning curve. And it's like, well, yes, but it's going to be a learning curve for your office. You're not alone in teaching it. Let the team come in and support you. And that is fun. And when it works well, it's very exciting and can be so effective. But, let's it's not always easy to shift away from traditional drug, surgery, symptom-based model. But let's face it, right now today, patients are demanding it. Media headlines are giving conflicting information on diet, supplementation, and other lifestyle modifications. So they're going to whoever they trust as their healthcare provider and asking a lot of questions. And so I know that you have a really compelling story, Danielle, that I was hoping that you would share with us tonight from your personal experience as a patient. And I would like to know, what did you expect from your providers during this health journey of yours?
So I'm assuming you're talking about being diagnosed with cancer.
Yes,
Probably
please.
not my hero,
If
right?
you don't mind, talking about that tonight, your story is quite compelling. Yes.
No, if my story can help one person, I don't mind talking about it at all. So, I'm 38 right now. When I was 36, I was diagnosed with stage 3 Hodgkin's lymphoma when my youngest baby was only 4.5 weeks old. And it was crazy because, her last trimester of pregnancy, I had all of these symptoms, but everybody just contributed to pregnancy, the insane itching, the third trimester, I was not gaining any weight, which, as you know, with you being pregnant, third trimester, that's when you gain the most weight, it seems like.
Mm-hmm.
And all these different symptoms just, they just said, oh, it's part of pregnancy, or, oh, you must be eating really healthy and exercising. And I'm thinking, no, I'm sitting on my butt watching Grey's Anatomy because it hurts to walk. But, I was happy I wasn't gaining weight. So when I was diagnosed with Hodgkin's lymphoma, first thing I did was they told me I was going to start chemotherapy. You're thinking of them pumping all of these poisons and toxins into your body. Of course, it's supposed to kill the cancer, but then what damage is it going to do, to the rest of my body? And, that baby, her first year of life, my brain is still kind of Swiss cheese from it. To remember it, I have to look back at pictures, because the chemo just, it's way worse than pregnancy brain. And so, I'm still working really hard on getting my memory back and doing those things. But when I found out I was going to have to start chemo immediately, first thing I did was I called one of my senior partners and I said, hey, I need to get on every supplement possible. What all do you recommend here? My doctor's telling me I'm going to lose my hair. He's telling me I'm going to get neuropathy. I'm going to lose feeling in my feet. I'm going to get constipated. I'm going to be so tired I won't be able to take care of my kids. I need to start on things now and be proactive with it. Thank God I had already been clean eating and had sugar out of my system for the last 1.5, 2 years. So I had, that under control. And, I started on, continued on many of our supplements and added more in, the isotonic vitamins. I can't say because the Shea laws, say that we can't say that our supplements did anything, but, I'm taking a ton of our isotonic vitamins, and all I know is I did not lose my hair. And my oncologist, he was adamant that I would. He said every single one of his patients on this regimen of chemo has lost their hair. You will lose yours. And I would go in there second treatment, and I go, I hadn't lost my hair, not going to lose it. You guys are crazy. And I kept coming in there, and after about the 5th treatment, they stopped preparing me for the loss of my hair because I was not losing it. When it came to, protecting my digestive system and supporting my bowels, I'm drinking our aloe. I'm drinking that too, and also with the antiviral properties, I didn't want to get sick. And just doing everything natural that I could because they're already pumping all of these chemicals into my body. I did not want to have to take, prescription medications on top of it, not knowing how they're going to interact and what they're going to do. And I mean, Sarah, I'm still blown away by it because I get a loss of words here with it, but not once did I actually look like a cancer patient. And I know that's crazy, when you're battling something like cancer, your biggest fear is death. But I knew God wasn't going to let that happen. So my fear was the pity, receiving pity from people. They would look at me and I would have no hair, or I would look sick, and they would give you that pity look. And because of the alternative lifestyle, keeping the sugar out of my system and eating clean and eating healthy and supplementing with high quality vitamins, I never looked like a cancer patient. I would run into people and they would ask me, are you sure you have cancer? Because that's what I heard, but you look really healthy, and you're out there painting your deck. I'm just kind of blown away. What's going on with you? And I would introduce them to the vitamins. But I'm in remission.
What did your practitioner think?
My practitioner was blown away. He really was. He was the sweetest man. He was just jaw dropped. He could not believe that I had no neuropathy. Vitamin B, the activated B complex, works to support, your neurological system and different things, mood, energy. And I'm sucking those down at treatment. I'm passing bottles out. I'm giving bottles away to other cancer patients receiving chemo. that, the nurses would tell me, who was depressed, who was having issues with mood and energy and things. So I'm giving out these bottles, and he was noticing a big difference in those patients as well. But he was blown away.
And you said, and how long have you been in remission now? How long?
Let's see. I was declared cancer-free middle of May last year. So it'll be a year coming up this May.
Wow.
And I have to look back to see the date because I've forgotten it. I know that sounds awful.
Yeah, that's amazing.
I'm just happy to hear cancer-free. But
I know we talk a lot about. Go ahead, sorry.
I was just going to say I fully feel like, me taking, healthy lifestyle into consideration with going through my treatments tremendously played a huge role in how well I did and how well I bounced back from each treatment.
How long had you been
that active approach?
How long? So TLS is our transitions lifestyle system. It's our low glycemic eating system. How long had you been following that sort of lifestyle? Did you
I started
before you were diagnosed?
Yes. Yeah, it's crazy how it all happened. Yes, I started using the TLS products and following the program September 2013, and I was diagnosed in July 2015. So the TLS products, the lifestyle change there, it all helped to get my body healthy to prepare it for that battle, that, fighting cancer.
Mm-hmm.
It was just absolutely amazing how it all fell into place.
It's God's plan, right? Sometimes that's what we try to look to science, and we try to there's some of it though where it's like there's got to be a little bit of whatever you want to call it, but some of that sprinkled in there, some sort of higher power. So
definitely divine intervention.
Yeah, right. But so you said you're youngest, so we haven't told everyone, how many kids do you have, Danielle?
Oh, Sarah, I am a baby factory, so I have 6 kids. and only one of those little blessings was planned, so that's crazy.
Again, a little more of that divine intervention in there.
Yes, God had his own plan. So yes, I have 6 wonderful children, and I work on them with their healthy eating and keeping their guts healthy, and staying off antibiotics if at all possible.
Mm-hmm. And so, are you using nutraMetrix nutraceuticals within your own family, and what do the kids think about it?
Absolutely, yes. On the older ones, they're actually taking, the isotonics. All of the younger kids, they use the DNA Miracles. They love them. It's crazy, the DNA OPC3 chews. My 4-year-old, he eats them like candy. We have to hide them from him. And when he gets a hold of the bag, he's going, "But it's my medicine. It'll make me healthier." And I go, "Yes, Henry, but you don't need to eat a whole bag." Same with Katie, the youngest. She'll pull a laundry basket over there to climb up to get to them because they love the way they taste. The kids know, with their liquid aloe, they know exactly where to measure it out. They drink 2 ounces a day. They love it. I don't even have to tell them to do it. They just go and pour it in the cup. It's keeping their digestive system flowing. So it's crazy. Kids do follow what they see their parents doing. It really is
like
crazy.
that old commercial where they're like, "Hey, give it to Mikey. If Mikey likes it, it's got to be good, right?" Like, he likes it.
Yes.
Right? And it's like,
yes, in my house we say,
"Give
it to Henry."
Yes. So if Henry likes it, it's got to be good. I mean, that's something I think that practitioners, they worry about. They say, "Well, will my patients like it?" And we always say, because same thing, use this with my family, and my daughter, she can't get enough of it. Before we started this call, she was screaming to my husband, "I need my vitamin," because we have a whole bedtime routine that includes them. And so I just think that's not only will patients be receptive to it, but the whole family will. And so Danielle, what are your hopes, just to, take a step back and look at the broader scope of healthcare, knowing what you know now and knowing how physicians have an opportunity to get educated in lifestyle intervention. And so, God forbid, if anything does, if some sort of chronic disease does come into, your family's life again, the foundational health is so important. And we just want everyone to get educated. We want practitioners to be educated. We want patients. We want moms. We want, everyone to get educated in the alternative, because it is becoming more mainstream, and we want to give good quality scientific information. So what are your hopes for the changing scope of healthcare, for when your kids down the line become parents and have to take care of their families?
In a perfect world, every physician would have all the time in the world to fully take care of their patients. That would be the perfect world. I don't foresee it ever getting like that. That's why I love nutraMetrix, because the physicians can utilize other professionals to help them integrate, the healthy lifestyles into their office. I would love to see it become more mainstream. I would love to see people become more educated on eating healthier. And, when you say eating healthier, it doesn't mean they're going and eating fat-free this and fat-free that. They're actually looking at the labels, that their food contains, instead of jumping on the bandwagon for this drug here because it's going to, help you lose weight, or it's going to do whatever, that, people will start taking a more proactive approach to working on, I guess the underlying factor, what's causing it, what's causing your high blood pressure. Yes, it could be genetic, but it could also be that you probably need to lose some weight. You need to eat healthier. You need to pull the salt out. You need to, be supplementing your diet with high quality vitamins, rapid absorbing vitamins. My hope is that everybody will take a more proactive approach with their health care and with their life in general.
That sounds amazing.
We can always hope and pray. That is. And, as parents, this generation, you're talking about the next generation, which is our kids or grandkids. And so as parents, it's our job to be teaching this to the next generation, as parents and grandparents, because that's how I think that's going to be the fastest way to get people taking more control of their health.
Mhm. Mhm. In the over decade that I've spent in healthcare, sometimes it takes the practitioners, they have to change themselves first. It's one of those things, that people are going to do as you do, not just as you say. And so I would hope from this message, and from you as with your background as a nurse in so many settings that you've worked into, is that you started with yourself, and you started with your home, and you started with your family, and you saw all those personal effects. And it's hard to not want to, after a story like yours, go and shout from the rooftops and say, get yourself a little bit more education. Let's start now when there isn't a problem, and let's start with some foundations, whether it is a lifestyle program, whether it is a, like you said, high quality, high absorbable nutraceuticals, or something in the realm of genetic testing, all those things which nutraMetrix has under its umbrella within the catalog. And just taking the first step and getting educated, which is what tonight's all about, is just that little introduction. And I think people are really surprised. I know I work for the company, and I know that we have amazing practitioners like you, Danielle, who really support the cause, the mission, the division of nutraMetrix. And I'm always just blown away when we do have educational seminars or summits or, conferences, when you have that many like-minded practitioners in one room, how amazing it is. And
it's beautiful. It is. And you just look around the room and you go, oh my gosh, just think once this number like triples and quadruples, and before you know it, it's going to be just massive amounts of like-minded people. It's exciting.
Yeah, I'm seeing that. We are seeing that because the scales are tipping. And like you said, whether it's the financial burden where practitioners are saying, I can't do this anymore. I can't practice the way I've been practicing. And so I need to do something else. And I really think looking towards a lifestyle model is something that is viable, but you need to have a strategic partner who can come in. And I like the way that you mentioned it. The team will come in and work with the staff. And so if someone's on this call and they are evaluating nutraMetrix and the mission, and whether you're evaluating this as a business owner, if you own a practice and you're saying, well, how could I do this? Get with a nutraMetrix consultant so they can come up with a customized proposal and lay out an implementation plan. But if you're also looking at this as someone who might be that implementer and facilitator, like I know you work a little bit more as now, Danielle, and whether it's just facilitating in your own family or your own community, or I know you're active on social media and bringing together some colleagues and some former colleagues of yours and people that you've known through the field. I just think that's where it starts. It's on that one-on-one basis. And that's how everyone got on this call tonight, is someone invited you. And, to get back with them to say, what is my next step? And I believe that the next step is to whatever, the next informational seminar you can get to, whether it's one of our nutraMetrix events where we have a couple nutraMetrix consultant trainings, which are appropriate for practitioners and potential consultants. We have some online summits that are coming up. We have a couple boot camps across the country in 2017. And even locally, we have things like general product trainings, which are often conducted by some local health professionals. Or we can look to the internet for a plethora of information from some of our corporate speakers or our clinical director, Dr. Deidre Mason. And so the education is there. I would just say whoever got you on this phone call, get back with them, get that information, because what we're doing with nutraMetrix is exactly aligned with what practitioners, patients, moms, families, what we're looking for and what we're demanding as we change this landscape and we try to fight this battle of chronic disease. So Danielle, is there anything else that you'd like to add before we wrap this up?
No, Sarah, but I am so glad to have you as a friend and fighting this, this epidemic here with each and every one of us here. It's amazing. Everybody working together. Our children will be healthier, much healthier than people are expecting.
And more educated too. They'll know.
Yes,
because
much
you'll
more.
pass that on. And the possibilities. And I just love that. I love that technology also makes it so it's so accessible. It doesn't have to be expensive. It doesn't have to be a big time commitment. And whatever you can start with is just a great start. And that's what nutraMetrix can do, is can walk you through this. So I've appreciated everyone's time this evening on our national conference call that occurs live, if you're listening live, the third Thursday of every month. And if you're listening to this as a recording, thank you so much for taking the time to listen to us. If you'd like more information about nutraMetrix or any of our upcoming events, I invite you to go to nutraMetrix.com, and you can check out all of our upcoming events on our events tab under my account. And otherwise, I hope everyone has a spectacular night. Again, my name is Sarah Tegender, your National Sales Manager, and I appreciate everyone this evening, and I'll see you next month. Thanks, Danielle, again.
Thank you. Good night.
Good night.